My name is Jean Wills. I'm doing the remediation video of the insertion of the IV. And I performed hand hygiene, got my gloves on. I spoke with the patient, identified her by her name and date of birth, looked at her wristband. She gave consent and she was educated on the IV insertion. So I'm going to go ahead and get started here. First off, actually, I'm going to prime the connecting tube. Careful not to touch anything. I'm going to go ahead and inject some fluid here. I'm going to unclamp that until I see water coming up, and then I'm going to go ahead and clamp it. Put that off to the side, keeping it nearby. And I'm going to go ahead and apply the tourniquet 4 to 6 inches above the site. And then, oops, let me fix this. Sorry. So applying the tourniquet again. And 4 to 6 inches. Checking for a distal pulse to make sure that the tourniquet is not too tight. And I have found one. So I'm going to go ahead and also get started. I'm going to clean the site. Cleaning for a total of 30 seconds, going 10 seconds up and down, 10 seconds side to side, and then 10 seconds in a circular motion. And I'm going to go ahead and grab my needle. I have a 22 gauge needle. I'm using a smaller one just because I have a geriatric patient here. Let's see if I can do that. Going to anchor the vein. I'm going to go in at a 45-degree angle. And then once I see blood in the chamber, I'm going to go ahead and advance it 1/4 inch. And going to support that there, pulling out the needle. And then hitting the safety, putting that off to the side into the sharp spin. And then I'm going to go ahead and undo the tourniquet. And then I'm going to apply the tubing here, being careful to not touch the ends. And I'm going to unclamp it. I'm going to aspirate and pull back, seeing that I got blood. And then once I do, I'm going to inject some of the saline in there. Then I'm going to undo this with one hand. Putting the cap back on. Oh, there's no cap for that one. And so put this down. And then I'm going to go ahead and apply the dressing. Just right where the connections meet, but not completely covering it. Just to hold it in place. Going to remove the the white part, taking off the part where I put my initials, date, and then the size of the gauge. And then I have my pieces of tape here, where I'm gonna go just underneath to support it and create a little chevron connecting here. And then another one across for extra support. And then I got my pen here, putting my initials, today's date, and then the gauge, which is a 22 gauge. And then I'm going to go ahead and clean up my mess. So I'll remove my gloves and perform hand hygiene, and then also check in with the patient for any discomfort or pain.